Next, we'll be talking about the fat-soluble vitamin D. In addition to being a vitamin, vitamin D is also a hormone. And hormones are substances that are created by an organ or tissue in the body and enter the bloodstream with a physiological target at another organ or organ system. In the case of vitamin D is derived from cholesterol and synthesized from sun exposure. And we know that sunscreens of over an SPF of 8 can actually decrease this synthesis by up to 95%. However, this doesn't mean that the recommendation is to go to a tanning bed or lay out in direct sun, but instead to expose the hands, face, and arms 2 to 3 times a week for 5 to 10 minutes at a time. And we go with the higher end of this recommendation for individuals with darker skin tones. Because of insufficient sun exposure, vitamin D is considered an essential vitamin. It is activated by enzymes in the liver and kidneys into its usable form, and its deficiency can cause disease. Activation of vitamin D in the body happens in a cascading reaction. First, 7-dehydrocholesterol is activated by the sun, travels to the liver where it is converted into 25-hydroxyvitamin D, and then to the kidneys where it becomes its active hormone form of 1,25-dihydroxyvitamin D3. It's important to note that individuals that live above the 37th parallel, marked on this slide, are at higher risk of vitamin D deficiency and may need supplemental vitamin D from a supplement or their diet because of a decrease in sun exposure. Vitamin D has several functions, including the regulation of blood calcium. Vitamin D, along with parathyroid hormone, play important roles in regulating blood calcium levels, which are important to maintaining health and ability. Regulation of calcium and phosphorus absorption is also a function of vitamin D, and it reduces the kidney excretion of calcium, regulating calcium deposition in the bones, which is important to growth, bone formation, and bone sustaining. Vitamin D also influences normal cell development, has been linked to a reduction in breast, colon, and prostate cancer at adequate levels. One of vitamin D's most important roles is in bone formation. So vitamin D causes calcium and phosphorus to be deposited in bones. Vitamin D is also essential in strengthening bones. And a deficiency in vitamin D among children is known as rickets. Rickets is really the result of low vitamin D levels. And children who are at high risk of rickets include those infants who are breastfed with low sun exposure. Because of this, many pediatricians and dietitians will talk to new mothers who exclusively breastfeed and provide supplemental vitamin D drops for exclusively breastfed children. In older adults, osteomalacia, or soft bones, is a rickets-like disease. And this is a consequence of low vitamin D level in which bones lose minerals and become more porous. Food sources of vitamin D include fatty fish such as salmon or herring, fortified milk products, so making sure if you are getting vitamin D from your milk that you're checking to make sure it is a fortified milk product, and some fortified cereals. However, your best bet is still through sun exposure. This is a nice source, a nice depiction of some of the sources of vitamin D. Again, you can see that salmon, sardines, and tuna are great sources of vitamin D. Fortified milk products are also good sources. And again, fortified cereals can be adequate sources of vitamin D. However, it may be necessary to supplement vitamin D. There is an RDA for vitamin D, and that's based on the amount needed to maintain bone health and normal calcium metabolism. This is 15 micrograms per day, or 600 international units per day, for individuals aged 1 to 70. For individual adults aged over the age of 70, the recommendation is 20 micrograms per day. And while intake of vitamin D from foods and supplements can help you meet the recommendations, the best source of vitamin D is your body's own ability to produce it. Food sources of vitamin D are limited, so in addition to some sun exposure, someone may need additional vitamin D through supplementation. Vitamin D can be toxic, and this is especially important during infancy and childhood. Because of this, there is an upper level of 100 micrograms a day for individuals over the age of 9. Typical symptoms include high blood calcium, weakness, loss of appetite, mental confusion, and increased urine output. Because vitamin D toxicity can result in the overabsorption of calcium and calcium deposits in organs and blood vessels.